Hi, everyone. My name is Dr. Kristen Lindgren, and welcome back to the podcast. This week is spicy. A study out of Yale was just published this week on a preprint server on some potential disturbing long-term effects of COVID vaccination. If diving into the details of potential long-term immune system damage related to vaccination sounds interesting to you, then grab your headphones and let's go. The Yale study exposed vaccine injuries, immune collapse, and what comes next.
Great news, the vaccine is on its way. Oh, really? That's right, it's a brand new mRNA vaccine, so mRNA, that's never been done before, right? Oh no, it's been done before, it just never made it out of the testing phase because all of the animals kept dying, but it'll be different this time. How so? Well, we're not going to do the animal testing, so you're just going to go straight to testing on humans? Yeah, you could say that. I mean, even so, don't most vaccines take years to develop and decades to test? It's here, the vaccine is here. Already? That's right, it's here and it's 100% effective. No transmission, no infection, you don't have to wear a mask or stay locked down anymore. Wow, really? Yep, except for the things about the mask and lockdown, yep. Okay, but it's 100% effective? That's right, 90% effective. And frankly, 85% effectiveness is really incredible. Oh, so it's only like 85% effective? Not quite. It's more like 75%. But hey, 65% still very good. And I mean, they said we'd never even get to 50% effectiveness, and we did almost. So 40%, really great achievement. So it's only like 40% effective now? For a bit. A bit? I mean, it wears off. So, well, after how long? Like 4 to 6. 4 to 6 what? Booster shots a year.
It started with a text message. I don't feel right. A 32-year-old woman, we'll call her Sarah, was an endurance athlete, a marathon runner. She was the kind of person who thrived on early morning miles, crisp air in her lungs, and the rhythmic pounding of her feet on the pavement. But that morning, something was different. Her legs felt heavy. Her heart was racing. A crushing fatigue settled over her, as if someone had drained the energy right out of her body. At first, she shrugged it off. Maybe I'm just overtraining. But days turned into weeks, then months. Doctors ran tests, blood work, MRIs, heart scans. Nothing. They told her she was fine. Maybe a little anxious. Maybe working too hard. Maybe it was long COVID, except she'd never actually had COVID. Frustrated, she started to do her own research, reading stories of others with similar symptoms. Her heart sank when she saw the pattern. She wasn't alone. Online, she found thousands of others with the same story. Young, healthy people, athletes, doctors, teachers, nurses, who'd got the COVID vaccine and never felt the same again. Her case wasn't an isolated incident. It was part of something much bigger, something no one wanted to talk about.
Is a belief that rushing this in the way that it's been rushed, and I know they put out graphics that say things like we didn't cut corners, we just straightened out the road, I think is one graphic that the U.S. Public Health Service is.
For nearly 4 years, these warnings were brushed aside as conspiracy theories and misinformation. The media dismissed them. The medical establishment ignored them. The vaccine injured, labeled as anxious, gaslit, left to fend for themselves. The stories I could tell you, well, if you have eyes to see, you've known this for years. But now the evidence is undeniable. A newly pre-published Yale study has finally confirmed what many suspected all along. The vaccine's spike protein has been found in patients up to 709 days after injection. Immune cell dysfunction and viral reactivation suggest long-term immune system impairment. And the very institutions that pushed for global vaccination are suddenly, quietly changing their tune. This week, we take a deep dive into this groundbreaking study, the case studies that no one wants to talk about, and the uncomfortable questions that demand answers. If the vaccine lingers for years, what is it doing to our bodies? And why isn't anyone in the mainstream talking about it? That was rhetorical. The Yale study, a smoking gun? Sarah's story isn't unique. Over the past 3 years, thousands of reports like hers have surfaced. Young, healthy individuals developing chronic fatigue, autoimmune disorders, cardiovascular issues, and neurological symptoms after receiving the COVID-19 vaccine. But until now, these cases have been dismissed as coincidental. Then came the Yale study. Published just days ago, it changed everything. For the first time, a team of pro vaccine researchers from one of the world's top immunology labs has documented something alarming. The spike protein from the COVID-19 vaccine is still circulating in some patients' blood nearly 2 years after their shot. The immune system in these individuals appears suppressed, dysfunctional, and chronically inflamed. Many of them are showing signs of reactivated viral infections, latent infections like Epstein-Barr, shingles, and herpes that should have been kept in check. The implications are staggering.
Which is very common in the vaccine injured is what's called autoimmunity. So some of the domains in the spike protein look very much like the host's antigens. So it's called molecular mimicry. So what happens is when the host mounts an immune response against the spike, at the same time it causes antibodies directed against the host's own tissues.
The Yale researchers studied 42 individuals with post-vaccination syndrome, or PVS, and compared them to healthy vaccinated controls. What they found was startling. CD4 T cells, essential for immune function, were significantly reduced. CD8 T cells, often linked to inflammation and autoimmune responses, were increased. Levels of circulating spike protein were still present in multiple individuals up to 709 days post-vaccination. That means that in some people, the body isn't clearing the spike protein as expected. It's persisting, lingering, stimulating the immune system in ways we still don't fully understand. Let's talk about Dr. Michael Langley, a healthy 42-year-old physician. No pre-existing conditions, no history of autoimmune disease. Like most doctors, he got vaccinated early. He believed in the science. He trusted the data. But 3 weeks after his second dose, something changed. Severe brain fog, tremors in his hands, chronic fatigue so debilitating that he could barely get through a workday. His colleagues said he was overworked. "You need a vacation, Mike." But the symptoms didn't go away. They got worse. Neurologists ran tests, MRI scans, blood work, spinal taps. Everything came back normal. Yet within 6 months, he was forced to retire from medicine. "I couldn't hold a scalpel. My hands shook too much. My patients deserved better." Dr. Langley's case was eerily similar to dozens of others. Doctors, nurses, and frontline workers developing mysterious, debilitating symptoms that defied diagnosis. The one thing they had in common? They'd all been vaccinated. The Yale study may be the first to document these changes at a cellular level, but the truth is, these cases have been unfolding in real time for years. So why weren't they taken seriously? Why did public health officials ignore these results? Why did public health officials ignore these reports? And if the spike protein from the vaccine is still present in some people 2 years later, what else is it doing in the body? That's the thing about a medical mystery. At first, it's just a collection of scattered cases. Then it's a pattern. Then it's something much bigger. And more importantly, what can be done about it? The immune system under attack? Sarah, Dr. Langley, and the thousands of others who once felt invincible now felt trapped in their own bodies. They all have one thing in common. Something inside them isn't shutting off. Their immune systems, the very thing meant to protect them, are stuck in overdrive. Or worse, burning out. It turns out the Yale study wasn't just about persistent spike protein. It uncovered something far more unsettling. The immune system in post-vaccine syndrome patients looked eerily similar to that of the chronically ill, specifically people chronically ill with AIDS. Key immune cells were depleted, like CD4 T cells, the same ones HIV attacks. Markers of chronic inflammation and autoimmune activation were off the charts. For years, we were told that the vaccine worked by priming the immune system, a short-lived response, a memory boost, nothing to worry about. But what if it did something else?
The other day who took one shot in 2021. Now she's developed a rheumatological complication. I measured antibodies to the spike protein in her, and she never had the virus. So the antibodies to the nucleocapsid were 0. But you know what? Even now, coming up on 3 years after the shot, John, she still has antibodies against the spike protein. So I can tell you, even though the vaccines don't work, they still raise a sustained immune response, which could lead to complications within the human body.
Let's break this down. When a virus infects your body, your immune system fights back. The battle ends, the immune system retreats, and your body moves on. But what happens when the threat never leaves? That's what Yale's researchers are worried about. The spike protein from the vaccine isn't behaving like a normal antigen. It's lingering, circulating, stimulating the immune system longer than the 24 to 48 hours we were told about. Over time, this constant exposure could be leading to immune exhaustion, similar to what's seen in chronic viral infections like HIV and hepatitis. And then there's the autoimmune connection. Because if your immune system is constantly attacking something foreign that refuses to go away, eventually it might turn on you. This could explain why so many vaccine-injured individuals suddenly develop strange autoimmune conditions. New-onset rheumatoid arthritis, when their joints, once fine, suddenly swell with pain. Hashimoto's thyroiditis, when their own immune system starts killing their thyroid. POTS and dysautonomia, when their nervous system no longer regulates blood pressure, causing dizziness, fainting, and crushing fatigue. And perhaps most alarming, reactivated viral infections. Meet Jessica, a 37-year-old mother of 3. No pre-existing conditions. Healthy. Active. She got her first COVID shot in 2021. Nothing happened. And then the second dose. A few weeks later, an itching, burning rash appeared on her ribs. Shingles. Odd, but not unheard of. Doctors told her it was bad luck. But then it happened again. And again. 5 outbreaks in a single year. Doctors were stumped. They ran tests, blood work, autoimmune panels. The only thing that stood out was her T cell counts were lower than normal. Her immune system, the thing responsible for keeping latent viruses like shingles in check, wasn't working like it used to. Her body was acting like that of someone much older, much sicker.
This in the laboratory is an uptick of herpes family viruses, molluscum, human papillomavirus, all sorts of viruses, mononucleosis, etc., reactivating at levels, and I'm a pathologist, so we see this in the laboratory, and I'm seeing the early signal. Well, guess what else that CD8 cell does? And some receptors on some of these T cells called toll-like receptors, and there's a certain pattern of them. They keep cancer in check.
Epstein-Barr virus, or EBV, infects almost everyone at some point in their lives. Most people don't even realize they've had it. It lies dormant in the body, kept under control by the immune system. But when the immune system is compromised, EBV reactivates. It's been linked to chronic fatigue syndrome. It's been linked to autoimmune diseases like multiple sclerosis. And now, thanks to the Yale study, we know that many post-vaccine syndrome patients have EBV reactivations. This raises a interesting possibility. Could the vaccine be suppressing the immune system just enough that old, dormant infections are waking up? Could this explain the massive surge in chronic illness cases over the past 2 years? And if the immune system is struggling to control old infections, what does that mean for new ones? Because if this pattern continues, the real crisis may not be COVID-19. It may be an entire generation left with weakened immune systems. The Pfizer files, what they didn't want you to see. It started in early 2022 when a group of scientists and lawyers fought to get Pfizer's clinical trial data released. The FDA had initially argued that these documents should be kept secret for 75 years. Yes, 75 years. Wait, what? Because inside those documents were early safety signals. A 3.7% rate of serious adverse events among trial participants, thousands of reports of neurological, cardiovascular, and autoimmune issues within weeks of the rollout, an internal memo stating that, quote, unexpected issues with immune function, end quote, required further study. They knew, but instead of halting the vaccine rollout, they doubled down. Governments were locked into billion-dollar contracts. Health officials dismissed concerns as misinformation, and social media platforms censored, banned, and silenced anyone who questioned the official narrative.
We do not know what the long-term effects of the mRNA vaccines are. And it is I would go beyond borderline. I would say it is immoral and unethical to keep using those right now. Okay, if you're going to insist on giving people COVID vaccines, there are simpler, cheaper ones that don't have this question about what they do long term. The mRNAs, at this point to me, they're a failed product and they basically should be withdrawn.
Pfizer made $100 billion in revenue from its COVID-19 vaccine in 2022 alone. Moderna, another $37 billion. But here's where it gets interesting. Key health officials, including Dr. Anthony Fauci, members of the CDC, and executives at the FDA, held financial stakes in vaccine companies. Regulatory agencies received massive funding from the same pharmaceutical giants they were supposed to be regulating. Government contracts ensured that even if the vaccines failed, Big Pharma still got paid. This wasn't just about public health. It was a business model, a machine designed to push a product, eliminate liability, and silence dissent. And if that meant ignoring safety signals, well, so be it. The regulatory capture, why no one spoke up.
What I want to do is, I'm not a scientist. I want to empower scientists. I want to make sure that science is unobstructed by vested or economic interests.
If you're wondering, how could this happen? How could so many experts stay silent? Let's talk about regulatory capture. The FDA receives nearly 50% of its funding from pharmaceutical companies. The NIH holds vaccine patents that generate millions in royalties. The CDC officials left their government roles to take high-paying jobs at Pfizer and Moderna. They weren't watchdogs. They were salesmen. And when reports of myocarditis, neurological injuries, and immune dysfunction started to emerge, instead of investigating, they launched a campaign of suppression. Doctors who spoke out, silenced. Scientists who questioned the data, discredited. Patients who were injured, gaslit. Dr. Patrick Winston had been practicing medicine for 25 years, a respected internist, a man who believed in evidence-based medicine. Then, late in 2021, he noticed something strange. Young men coming into his clinic with myocarditis within weeks of getting the vaccine. Women experiencing sudden autoimmune flares shortly after their booster shot. A spike in cases of dizziness, neuropathy, and long-term fatigue, unlike anything he'd seen before. When he raised concerns to his hospital's administration, they told him to keep quiet. When he refused, they reported him to the medical board. Within months, his license was suspended for spreading vaccine misinformation. This wasn't about science anymore. It was about control, a machine that couldn't afford to admit mistakes. Because if the truth got out, the entire house of cards would collapse. And now it is collapsing. Yale's study is just the first crack in the dam. More studies will follow. More whistleblowers will come forward. And when they do, the question won't just be whether these vaccines caused harm. It will be, who knew? And how long did they cover it up? The damage might be done. The vaccine is out there. People are injured. And no one in power seems willing to acknowledge it. So what do we do now? The first step is acknowledging the problem. Let's be clear. If your immune system has been compromised, you deserve answers. If your body hasn't felt the same since your shots, you are not crazy. And if you've been gaslit by doctors, censored online, or dismissed by your peers, you are not alone. But here's the uncomfortable truth. The mainstream medical establishment isn't coming to help you. The pharmaceutical industry will never admit fault. And the CDC, they're already sweeping this under the rug. So if you want answers, you're going to have to find them yourself. Or, more importantly, we're going to have to find them together. The detox protocol. Can you get rid of the spike protein? Since 2021, doctors, researchers, and independent scientists have been studying ways to clear spike protein from the body. And while no official treatment exists, because let's be real, do you think Big Pharma is going to fund a cure for vaccine injury? Promising protocols have emerged. Nattokinase, bromelain, and serrapeptase, enzymes that break down spike protein and clear it from circulation. Ivermectin and hydroxychloroquine. Controversial, some may say, but showing promise in binding and neutralizing spike protein. Glutathione and N-acetylcysteine, powerful antioxidants that support cellular repair and detoxification. Fasting and autophagy, the body's natural way of clearing out damaged cells and misfolded proteins. If the Yale study is right, and post-vaccine syndrome involves immune suppression, inflammation, and viral reactivations, then the key isn't just detoxing spike protein, it's rebuilding the immune system. Vitamin D3 and K2 are essential for immune modulation and reducing autoimmune risk. High-dose vitamin C acts as an antioxidant and protects against viral reactivation. Zinc, quercetin, and EGCG support T-cell function and immune recovery. Low-dose naltrexone is a potential game changer for reducing autoimmune inflammation. For those dealing with chronic fatigue, brain fog, and recurring infections, rebuilding the immune system isn't optional. It's critical. And yet, how many doctors are actually talking about this? How many are even looking for solutions?
I'd tell you another deception. The entire country medical system calls the chronic problems after COVID, they call it long COVID, right? You've heard of the term
Yes.
disease long COVID. So I'm an expert at it. But the reality is, if you look at my practice, maybe 1,200 patients, 70% are long vax, not long COVID, meaning all of their issues, the syndromes, started after the vaccine, not COVID.
Meet David, a 49-year-old father of two. Before 2021, he was healthy, active, never missed a day at the gym. And then came the shot, and everything changed. Crushing fatigue, unrelenting brain fog, chronic infections that wouldn't go away. Doctors told him it was in his head. They ran tests. Everything came back normal. But David refused to accept that answer. Instead, he started researching on his own, and he found nattokinase and bromelain. Within weeks, his brain fog lifted. He started high-dose vitamin C and glutathione. The chronic fatigue began to fade. He eliminated inflammatory foods, started fasting, and within months, he felt like himself again. Now he's helping others do the same. Because here's the thing. People are healing outside of the system. They're finding answers outside of the mainstream narrative. And they're proving that recovery is possible if you're willing to look for it.
And to get one of these vaccines, they are safe and effective.
If there's one message that needs to cut through all this, the vaccines are safe. I promise you, they are safe and effective. Listen to Dr. Fauci.
When we say that something is safe and effective, we mean it's safe and effective for everyone.
Our vaccinations against COVID-19 are safe. They are effective, and they're more important than ever.
This vaccine has gone through the necessary and rigorous evaluation that ensures the vaccine is safe and highly effective.
Let's get one thing straight. The biggest conspiracy theory wasn't that the vaccine might cause harm. The biggest conspiracy was that it was ever truly safe in the first place. They said the spike protein would clear in days. It didn't. They said myocarditis was rare. It wasn't. They said vaccine injuries were in your head. They weren't. They said the mandates were about health. They weren't. They lied. And when people started waking up, they doubled down. They censored. They ridiculed. They silenced. But here's the thing about silencing people. The truth doesn't disappear. It doesn't go away. It only gets louder. And now it's deafening. Take action now. Join the movement. Connect with those fighting back. Tell your doctor, no more mRNA, no more experimental tech. And the next time they try to force compliance, you already know the answer. Never again. Sorry, that was tough to get through for a whole bunch of reasons. The past several years have been difficult for me personally, professionally, and even harder for so many of our patients as we got to witness firsthand how they were gaslit, how they were ignored, and how the system failed them. We can't let it happen again, folks. We have to stick together. Thanks for listening. I'll see you for the next one. Bye for now.